tell me what the status is of the vaccine rollout. We've been seeing lots of information about being behind where the federal government had hoped. How is your process going?
Well, first, I want to thank you for having me today. And I want to just thank all our healthcare workers at Summit CityMD, and I'm so proud of them because we just launched our vaccine clinic, and I'll tell you all about that. We have seen to date over 2.7 million COVID-related cases. We are setting up our vaccine clinic. We already started in New Jersey. The DOH worked with us very closely. Since we are not a hospital-based system, we are a fully ambulatory system, and we got our COVID clinics up and running, and we probably could handle at this point a minimum of about 1,000, 2,000 vaccines a day. We're going to be opening up other sites to accommodate it. In New York, with our CityMD sites, there was a little hiccup with the state and the city, but we have heard back from them. And on Tuesday, they are allocating us our allotment of vaccines so we could start with the healthcare professionals in the New York metropolitan area, especially the ones that are with Summit CityMD that already saw 2.7 million related visits with COVID.
Doctor, do you have a sense at this point of what the main logistical challenge is going to be in the first months of 2021 to get this vaccine, or these vaccines, I should say, out in the smoothest, most predictable, and highest volume way possible? Well,
Operation Warp Speed seems to be getting a handle on the logistics of getting the vaccine to the distributors. Then the distributors have to get it to the sites that are going to be performing the vaccines. I think that's where there could be potentially a little problem. Right now, with our site in New Jersey, with the Department of Health and with our distributor, we are using the Moderna virus, and in New York, it probably will be the Pfizer vaccine. We have to allocate appropriately because in New York, you're going to have these ultra cold refrigeration sites to be able to handle that and then distribute it. We have 130 sites with Summit, CityMD in the New York metropolitan area. So you have to distribute this in a timely fashion because it's going to start to thaw that vaccine to these sites. But we have it already planned, and we are moving in that direction.
Dr. Morgan, I'm curious what the testing landscape currently looks like. I mean, obviously, we saw a lot of people travel around Thanksgiving, and I think coming into different facilities such as yours, trying to get tests ahead of that. Are you seeing similar foot traffic right now? And I guess how easy or how hard is it to get one of those tests, whether it's because of symptoms or whether because you are traveling as a person right now in the New York area?
Right. So right now we're seeing probably about 24,000 patients a day in our urgent care sites. Of that, about 70%, like 17,000, are COVID-related visits. We actually have not seen a marked uptick since Thanksgiving in that. It's really been steady. And we have an app now for all our sites that I was very concerned about people waiting in the cold. So what we do is we get their name, we have an app, we text them, they come right back in, and we're able to screen them right then and there.
Shepard Smith here. Thanks for watching CNBC on YouTube.